Good evening, everybody. Welcome again this Friday. Today's what day? 7. 7 is a blessed day. It's a good day that we are here. It's usually 7 we get from the Bible that is a blessed day. And 8 is the day of complete blessings. So today and tomorrow we are blessed. So welcome again. We are coming from what is called the She Chooses to Live initiative. We keep saying that we like to give knowledge. That's what She Chooses to Live initiative is all about, to give knowledge so that people can make informed choices. The Bible says that my people perish because of lack of knowledge. So we don't want anybody to perish because of lack of knowledge. Where we can help, we will try to help. If you guide us which way you want us to help you, we will give as much knowledge as we can manage so that people are able to make informed choices in future. We usually are more tuned towards reproductive health. We deal with health in general, anything health we can tackle, but we are more tuned towards reproductive health and into public health because that's what at least this forum is more experienced in. But we can always even get experts if you wanted other things discussed. We can always get experts to discuss on this forum. So She Chooses to Live is an NGO that wants to give that kind of knowledge. I keep appealing to us who listen that it is very good that you're able to listen, and you're able to listen because you have a gadget that you can get internet to. But there are many Wajikos and Atienos and Mwendes out there who cannot access this. So we wish to find a way to get to them because they also need knowledge. And in fact, the lack of knowledge is more out there where the Wajiko lives in the areas where there is not a lot of resources that they get. So they are not able to access this kind of internet. And we would wish, we as She Chooses to Live, we would wish to also reach the Wajikos of this country and be able to help where we can. So if we introduce ourselves, to my left here is my tech guy. She's Marion Wakahe. I keep saying she's the one who puts me on and removes me from the talk. The talk is mine, but if she doesn't put me there, I can't talk. So there we go. And I'm Dr. Jane Wakahe, an obstetrician gynecologist who has also done public health. I wanted to do public health in an effort to know Wajiko. I got to know Wajiko a bit more when I did public health, and I got to know that she really, really does need help where health is concerned, where hygiene is concerned, where nutrition is concerned, many things where health is concerned, she needs help. And especially where reproductive health is concerned, she really does need help. So it's our hope that in near future we will be able to reach Wajiko wherever she is found in all the counties of this country and be able to either physically or through talks give the knowledge that they need. So today we are going to talk about one of the things that people have requested that we talk about. Like I say, I request you people to send questions, to send ideas of what you want to be talked about. Usually I just talk what many people ask about in my clinic, but this one was specifically requested for. So today we are talking about cancer of the endometrium or endometrial cancer. You'll hear me interchange those two words, endometrial cancer, cancer of the endometrium. Somebody wanted to know about it, and here we go. So today we'll discuss cancer of the endometrium. It's not a very long topic today. This one we are going to able to finish in one session. It's not a very big topic indeed, cancer of the endometrium. Now we recoup again and ask ourselves, what is cancer? And cancer is actually just a variant of the normal cells of the body. The normal cells, we are made with, everywhere we are made with cells, and the cells grow, multiply, and at some point they die. So they have a controlled kind of growth, and they have a lifespan. And after their lifespan, they die. The normal cells die. Now, what happens to cancer cells is, for whatever reason, they start to grow very fast in an uncontrolled manner. And instead of dying when they're supposed to die, they do not die. So they overgrow and they keep living on and on. And what happens then is that because of this overgrowth and this refusing to die, they tend to push the cells, the organs around themselves, and to even actually invade, like dig roots into organs around themselves, and put their cancer roots into those organs. They even sometimes will send messages and ambassadors through bloodstream and through lymphatic drainage. And they will send these messages to distant places, especially the lungs, the liver, and they'll send those what we call metastases. So the cancer will also be growing not only from the original area, but also from into other areas like the lungs, the liver, the brain. So they'll spread around, and that is called metastasis. So that's what cancer is. Now, what is the endometrium? Today we are talking specifically about the cancer of the endometrium. And what is the endometrium? The endometrium is the inner lining of the uterus. The uterus is got two parts. It's got the where the baby lives. That's the body of the uterus, and it's got the cervix, where the baby is closed in by the cervix, and the cervix finally opens to let out the baby. So the uterus is made of those two areas, the body of the uterus and the cervix itself. Now, the endometrium, the cancer we are talking about today, is the inner lining of the body of the uterus. It is the layer that makes a sponge every month in readiness to accept a fertilized egg, in readiness to start a baby growing in there. So that's the endometrial layer. It is the layer that if fertilization does not happen and the egg dies, then this is the same layer that disintegrates and comes out, and one gets their monthly period, the so-called the weeping of the disappointed uterus, because that layer has to disintegrate, and it's not getting a baby this particular month. So that is the layer we are talking about, and it lines the whole of the uterus. It's where the baby, if it happens to be fertilized, it's where the baby embeds into the endometrial layer, and where the baby finally makes its placenta and gets its feeding from. So that's the endometrium. Now, the cervix is lined by other cells. It's not lined by the endometrial cells. So there are different kinds of cancers that happen in the two areas. And the only time one will find endometrial cancer in the cervix is if the cancer has grown and invaded towards the cervix. So that's the cancer of the endometrium. Usually will start in the endometrium, but can spread to many other places. Now, for whatever reason, the cells of the endometrium, the endometrial layer, starts to multiply for whatever reason. This is unlike the cancer of the cervix, where I've told you people that the trigger in 99.7%, the trigger is the is persistent infection with human papillomavirus. That is the trigger for cancer of the cervix in the cells of the cervix. Now, the cells of the endometrium, the trigger is not known. We do not know what makes it happen. So for whatever reason, the cells of the endometrium starts to really multiply and become those unreasonable cells that refuse to die at their time and which overgrow and make roots into other places. So the trigger actually is not known. What are the signs of cancer of the endometrium? And these are a number. Unfortunately, like all cancers, at the beginning, there is actually no sign. At the very, very early time, there is absolutely no sign. But thereafter, there can be some increased vaginal discharge, which does not necessarily mean cancer. As women, we know that there is sometimes vaginal discharges increase, sometimes for no reason at all. I mean, not for no reason, but sometimes for healthy reasons, like during ovulation, the mucus, the discharge becomes more than usual. So there will be an increase in vaginal discharge, which again is not a very, very clear sign. There could be pelvic pain in the lower abdomen, a pain at the back. Again, every woman knows that there is always sometimes a pain in the pelvis and a pain in the back. So especially around menstrual time. So it's again not a very, very clear sign indeed. The other sign of cancer of the endometrium is dyspareunia. We talked about dyspareunia just recently, and dyspareunia means that pain during sexual intercourse that can be part of the signs of cancer of the endometrium. Now, the shall I say, heavier signs of cancer of endometrium is that there will be irregular bleeding. The bleeding can be irregular when somebody is during reproductive age. The bleeding can happen intermenstrual, so that it doesn't wait for the actual periods to happen. It can be it can be heavy bleeding, heavier. Sorry, a bit of water. Heavier than usual. It can be, and this is very important, it can be postmenopausal bleeding. And that's what I want us to take very, very seriously. I want us to take any funny bleeding as very serious, unless we know the reason why the funny bleeding is happening. There are times like when somebody is using things like Depo-Provera or even the implant that we implant on the hand. There are times that the bleeding will become irregular, and we know the reason. But if there is no foreseeable reason as to why bleeding is either heavy or abnormal or too many times or happening when it shouldn't be happening, then it is a very, very important sign, and kindly do not ignore, and especially if it is postmenopausal. And when we talk about bleeding, we are not talking about a lot of red blood coming out. If you ever experience something that is a brownish discharge through the vagina, or even a blackish discharge through the vagina, kindly see your doctor. So the weight signs are abnormal bleeding. The others can be with any other kind of condition. The other thing that can happen is the uterus can get enlarged. And when it is quite late, then there is weight loss. Like with all kinds of cancers, there is weight loss when it is quite advanced. Now, I said that we do not know what the trigger is. Like many cancers, we do not know what the particular trigger of this cancer is. But having said that, there are some conditions that are associated and which, if we put together, then can make the person, the woman, more prone to the endometrial cancer. And which are these risk factors, indeed, that make a woman more prone to getting cancer of the endometrium? And the first one is having either diabetes, having high blood pressure, and especially having both of them at the same time. If you have high blood pressure, you have diabetes, and you experience either postmenopausal bleeding or you experience funny bleeding when you're still in the reproductive age, kindly report to your doctor and let them check you out for endometrial cancer. It's one of the things, one of the risk factors, having both, having either diabetes or blood pressure or both. Now, the other thing that is associated with endometrial cancer is obesity. Obesity seems to be associated with very many things, but that's because it imbalances the body system, the body hormones when one is obese. The other people who are more prone to getting endometrial cancer are people who started their periods very early. People who like start off periods at age 9, and people who also finish their periods very late. People who are still menstruating at age 57, 58 there. So starting early and finishing late, the longer the bleeding time one has, the more likely the chances that they will, that if funny bleeding is happening, it could be that it is to do with endometrial cancer. The other associated factor is what is called nulliparity. That means a woman who has actually never given birth. If a woman has not delivered a baby, then that puts them at a higher risk of getting endometrial cancer. Then the older one gets, the more likely again they are to get endometrial cancer. So it's more of a menopausal thing than in the reproductive age. And then there is any imbalance in the system that imbalances the two hormones a female produces. A female produces an estrogen and a progesterone. If there is anything in the system that unbalances that production of equality of progesterone and estrogen, then that's a trigger, usually one of the risk factors of getting endometrial cancer. And a good example of this kind of imbalance is the people with polycystic ovarian syndrome. If somebody has polycystic ovarian syndrome, then they are more prone to getting endometrial cancer than the ordinary person. And then there is also the people who intake what is called hormonal replacement therapy. We do not want to have suffering when we are going through menopause. We want to have it peacefully. And one of the side effects, one of the problems that the dangers that can be caused by hormone replacement therapy is endometrial cancer. So if you have a uterus, which is where the endometrial cancer would happen, kindly try not to take hormone replacement therapy, because there are some of those hormones that can trigger endometrial cancer. And then there is a group of people, an unfortunate group of people who have had treatment for cancer of the breast. Sometimes the breast has been removed, but they also get a certain medicine called tamoxifen, which the intake of tamoxifen actually goes a long way towards triggering for endometrial cancer. So it's a hormone. It triggers. So for people who have had breast cancer, they have to keep an eye on their endometrium, because the intake of tamoxifen can make them more easily get cancer of the endometrium. And then there is some inheritance, which is not very clear. Some people who get colon cancers, some families tend to get colon cancers, and the people who get colon cancers, families who get colon cancers tend to get endometrial cancer. The same way, like people who get prostate cancers, I think I've told you before that if there is prostate cancers in the family, then one needs to be careful about breast cancer. So in this case, colon cancer and the endometrial cancer, they seem to kind of relate in the family. Now, let's talk a little about prevention of this cancer. This is not like the cervical cancer. I love cervical cancer because there's a lot you can maneuver around cervical cancer. For example, if your genitalia never touched anybody's genitalia, you're not going to get cervical cancer. But the same thing is not the same with endometrial cancer. Endometrial cancer, there is no absolute prevention of endometrial cancer. But having said that, we've heard that the things that tend to be risk factors are things like obesity. So weight management is very, very important. And especially with people with polycystic ovarian syndrome, not only do they have unbalanced hormones, they also have a problem with weight management. And this makes it a sort of double risk. So weight management is one of the ways we can try to prevent ourselves from getting endometrial cancer. Doing exercises is another one. Exercises tend to produce very good endorphins into the system that really raise immunity. And part of the way of fighting cancer, any cancer, is high immunity. So because then when one has high immunity, then the body tends to recognize cancer cells more easily. So the higher the immunity we have, the better. So do your exercise kindly. I would advocate that if you do not have to take hormone replacement therapy, kindly do not. And if you have to, then you have to really keep a very, very strict eye on how your endometrium is behaving. And by the way, how your breasts are also behaving when you're on hormone replacement therapy. And the other thing is kindly do not ignore whatever little sign you have. Do not ignore, because as much as you may not prevent it, we have said on this forum and the world over that if cancer is diagnosed early, cancer can be cured. So do not ignore any signs. Go to your doctor, let them get irritated with you for being there too many times. Be a coward, go to your doctor, complain. Do not ignore, because it is better to discover when it is early, because if it is discovered early, then it is curable. Cancer of the endometrium is actually curable if discovered early. So please go to your doctor. Now, treatment. What is the treatment? I always say in this forum, I don't talk about how to treat these diseases. I tell you to go to your doctor. But one thing I should say is that treatment will actually depend on at what stage the cancer has been found. So if it is found early, it will be a different kind of treatment to cure. If it is found later, it will be a treatment to manage. So treatment will depend on at what stage that the cancer has been diagnosed at. So kindly, again, I can't overemphasize this enough. Kindly, if you have any symptoms that are a bit out of the way, anything unusual, go and see your gynecologist. Now, having talked about cancer of the endometrium, there are some other things that may make cancer of the endometrium, which we are going to discuss two of them. Uh, so let's talk about them. Other things that would present as if it is cancer of the endometrium are things that are called endometrial polyps. Now, these are things like grow again from the endometrium. They grow like a hanging grape inside the uterus. They are they range in size from very, very small indeed to big ones that almost fill the cavity of the uterus. So they can be very, very different sizes. Now, polyps are usually, I say the word usually, benign. Benign means they are not cancer, they are not malignant, usually. But on some rare occasions, polyps can turn into being cancerous. So they need a very keen eye to keep an eye on any endometrial polyps. Now, what is the commonest, what do they present? How do they present these polyps? And again, they can actually be confused with endometrial cancer because they present in an older age group. Usually, the people who are actually undergoing perimenopause are the people who are most commonly getting endometrial polyps. It's a bit unusual in the younger generation, and in the younger generation, if it happens, it's actually quite rare. But if it happens, in fact, some of the times it's discovered because there's infertility. A woman is being unable to conceive because once the polyp is inside the uterus, it acts like if the uterus is pregnant and will not allow conception to happen. So in younger people, sometimes it is to do with infertility, but in the older people, then it is just a polyp that happens. And what are the symptoms of it? Again, there is irregular bleeding. The polyp can itself start to bleed. It's around perimenopause, and the polyp can start to bleed more frequently than usual and cause a bit of irregular bleeding. If one is still getting periods, then it can cause intermenstrual, just like cancer of the endometrium. It can cause bleeding in between periods. Polyps have a habit of getting somebody to get very heavy periods. So it can be very, very heavy period indeed. And like I said, in the young, it can cause infertility. Now, the risk factors. What are the risk factors of getting a polyp? The mere fact that one is around menopause or in early menopause, then that is a risk of getting an endometrial polyp. If a woman has high blood pressure or has diabetes mellitus, then they have a bigger chance of getting endometrial polyp. If somebody is obese, and if again somebody is taking tamoxifen, the medicine that is given to women who have had breast surgery or breast cancer. So this is something that can be totally confused with endometrial cancer. But like I said, usually polyps are benign. They are not malignant. They are not cancerous, but a few can turn cancerous. So when somebody has a polyp, your doctor may tell you, we wait and see, and really keep a very close eye on it, how it is going, or they may opt for surgery, for surgical removal. So your doctor will decide. Normally, it is diagnosed by an ultrasound, a pelvic ultrasound, which also is what is used to diagnose the endometrial cancer. So once a polyp has been diagnosed, then your doctor will tell you which way you should go. And there are many factors that they will get into the reasons why. They can tell you, we wait and watch, or they can tell you, let us do surgery. So that's one of the things, one of the Today I talked a lot in the office. I'm really dry, but I drank a lot of water also. Anyway, so that's one of the other things that can mimic endometrial cancer. And the second one that can mimic endometrial cancer is something called endometrial hyperplasia. Now, hyperplasia means thickening. So the endometrium, it's the endometrium gets shed during the period. So it kind of thins out during periods, but it starts to grow again, to grow that sponge again, all over again, to make a sponge that will hold the baby. But there is an amount of growth that happens before the endometrium is shed out again. Now, when there is hyperplasia, then the sponge is much, much thicker than what is normal, than what is expected. And this is usually found again by ultrasound. Now, endometrial hyperplasia is usually benign, usually. But just like endometrial polyp, there can be an element of it going malignant. And this is more so if the hyperplasia happens in a postmenopausal woman. When a woman reaches menopause, the eggs stop being released. So the body knows that there is no pregnancy that is going to happen. So the body does not thicken the layer awaiting for any pregnancy. So in menopause, the endometrial layer is very thin. It goes thin. So if perchance it starts to grow again and to become what is called hyperplasia, then there is a lot of suspicion after menopause that it could be not just hyperplasia but endometrial cancer. Having said that, in the people who are not yet menopausal, hyperplasia happens quite a bit. Unlike the polyp, hyperplasia happens quite a bit in women who are not menopausal, in women who are in their reproductive age. And usually it is only it is usually benign and will only become malignant in about 1 to 3% of all the women. But what it does is it makes the periods very heavy when they come. They'll come and become very heavy indeed. And they will also, there is usually not intermenstrual bleeding, but when the period comes, it comes very heavy. And what are the risk factors? The risk factors are that, again, it is the with weight, when how the obesity, the more obese somebody is, the more likely they are to get endometrial hyperplasia. If they are diabetic, if they are high blood pressure, and if they are taking tamoxifen, and of course if they are taking hormone replacement therapy. Now, all these, the endometrial hyperplasia, the endometrial polyp, and the endometrial cancer are diagnosed by ultrasound. So when you have these symptoms and you go complaining to your doctor and saying what you're feeling, they'll usually order a pelvic ultrasound and find out from the radiologist will report that either there is a polyp, or first of all, they'll report there is nothing. Usually there is nothing. Then they can report that there is a polyp, or they can report that there is hyperplasia, or they can report that it looks a bit suspicious. Then there are other tests that can be done that help again to explain further what it could be of the three. And those ones, your doctor, once they diagnose them, they will tell you what other tests you need to do to be able to decide, for them to be able to decide which way to manage you. So, takeaway one, do not ignore signs. They could be telling you that it is cancer. And like I said, when cancer is discovered early, when it is diagnosed early, cancer is curable. Indeed, like the endometrial cancer is quite curable, actually, very, very curable, because it takes a bit longer to spread out. So if it is found early, it is curable. The uterus has a habit of self-containing things. So by the time the things spread out of the uterus, then they have taken a bit of time. So it is kindly take away. See your doctor if you're feeling anything abnormal. Let your doctor guide you which way it is. They'll usually, like I said, do an ultrasound. So do not ignore symptoms. Follow your doctor's advice. And the next takeaway is if you don't have to take hormone replacement therapy, then do not. And the other takeaway is that, especially, I like to talk to postmenopausal women because they are wise women and they listen. So, postmenopausal women, if you see any sign of any bleeding coming through the vagina, go and check. It could be that it's just outside there at the vulva. It could be somewhere in the vagina. It could be the cervix. It could be the uterus. But do not ignore any bleeding. And even for the young, there is a way the body bleeds. The hormones go up and down, and the body bleeds in a certain way. If that changes, see your doctor. So the heaviest, like I said, the heaviest symptoms and sign of endometrial cancer is abnormal bleeding, postmenopausal bleeding, heavy bleeding, and bleeding in between menses. If those are happening, go and see a doctor. And then if you've not been having periods and you start having an ache, like you are cramping to get a period, that could very easily be a polyp because the uterus thinks it has got a baby inside and it's trying to deliver it. It could be a polyp. And like I said, polyps can be both benign or they can be malignant. So kindly take away. Do not ignore symptoms. Do not ignore any signs. Go and see your doctor. Now, I said this is a short topic, not very exciting, not a lot of fun where cancer is concerned. But yeah, I'll take questions now. If my tech guy can come back and we look for questions, then we'll answer any questions that are there. Yeah, it looks like there are again no questions. There are no questions. Yeah, it's like no questions whatsoever. I hope people understood. But take away. See your doctor. Bug your doctor. Go and complain. Let them think you're what is called hypochondriac. That you're pretending to be sick. Let them think that, but let them do the investigations and confirm that there is truly nothing. So that is good. Good evening, good evening, good evening. I can see a lot of good evenings. But this means there are actually no questions because we can see comments.
Yeah.
So, like I said, today was a short topic. We managed to cover it in one sitting. Yeah, I hope you're all doing your annual checkups because that's another way of catching things early. And annual checkup not only includes pap smear, but also includes pelvic ultrasound, breast examination, all those things. then you catch anything, you diagnose anything early. And when it is diagnosed early, it is treatable, it is curable. So we say bye-bye. Good. Bye-bye. Today you can sleep early and stay safe. We'll meet at some point again.